Good afternoon. Welcome to Facebook Live. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thank you for joining me for our broadcast. So today will be our usual broadcast. We'll talk about some facts, some pieces of news that have come out in the past week, and some just recommendations and analysis of all that before I sign off. And as always, if you have questions, please feel to send those our way and I'll try my best to answer them. So let's start with facts. And I'm going to have Matt pop up onto the screen some of our local facts here. So this is a number of cases in the county, and the red is this week, the blue on the top left there. The red is this week, blue's the week prior to that. And then the bottom left, red is past 2 weeks, and blue is the 2 weeks prior to that. And you can kind of see on that kind of a mixed pattern, because this past week looked pretty good. That we're starting to have, we had fewer cases than the week before that, but 2 weeks a little bit higher. So it must have not been last week, but the week before that we had a pretty good number of cases. So I'm still hopeful that we're getting close to the peak of this particular surge. Time will tell. We'll look at those numbers again next week. Also, on your right there is just your weekly update for COVID-19. And there's 3.8% positivity. Let's see here, 3.8% positivity, the number of cases. And then you kind of see on the bottom right there the different surges. There's a surge we're having now, and then there's a surge we had between March and May, and then on the far left, it only goes back to January. But if you actually went back into November, this particular graph goes up, I think, to 60 is what my eyes show me. In November, we had a day where we had 147 positives. So that surge was, in terms of number of people, was much higher than this particular surge. Just that the mix of people that are getting sick in this one and the mix of people in the hospital are different with this Delta surge than the previous surges, mainly because the folks who are older, by and large, have been vaccinated, and so they're less likely to get hospitalized or die, which is good. We're happy about that. So those are the facts I wanted to share from our area this week. And then I think Matt has the Illinois Department of Public Health state one. So that was I think that was yesterday's what I saw. You could see there are 2,989 new cases, 42 deaths in the state reported yesterday. 1,900 people were in the hospital, which is a little bit lower than last week when we went through that together. I think we were in the somewhere in the 2,000 range. 51 patients were in the ICU, and 241 were on ventilators. 7-day statewide test positivity is 3%, which is trending down, which is encouraging. 7-day rolling average of vaccines administered is 22,497. I would anticipate that to go up in the next week or two or three as folks who are eligible for boosters begin getting those. So I think that that number is going to include the booster people as well as people who are getting their first time dose or their second dose. Those who are getting Moderna or Pfizer, that is. Okay, IDPH 63%, 63.8 over the age of 18 are fully vaccinated, and 81.1% have at least had one vaccination dose. And then the U.S. average, 7-day moving average, is 110,000 cases with 689,534 deaths, with a daily increase of about 1,142. So the average cases is going down in the country compared to where it's at the last few weeks. As we talked about, the hospitalization and death part of that lags the actual cases. And that's why, like here in our hospital, actually our number of patients that we're taking care of has actually continued to trend up this week versus last week, just because there's a lag in that. So we're hopeful that trend here in the hospital will begin to go down soon. But that's kind of the numbers, the facts that I have this week. Some news articles that I thought are worth talking about. Yeah, of course, the CDC recommended boosters, and I know there was back and forth about who should get those boosters. But and then there's a booster clinic at the health department and the hospitals doing jointly on October 7th. So keep that in mind. Looks like you need to make an appointment. You can get those boosters as well if you just plug in, I think, vaccines.gov maybe. Anyhow, there's you can type in vaccines in your area, and I just did this yesterday, and I think within 10 miles of us, there are about 6 places that are giving the vaccine, the Pfizer vaccine right now. So even before that clinic, there's an opportunity to get a booster if you fit into one of those categories. And those categories, 65 and over, it's they. I think the wording was, oh, thank you. I think it's suggested was the word, or recommended for 65 and older. And if you're over 50 and you have a health condition, recommended if you're over 18 and you're in high risk settings, or you're in situations or where you might get at higher risk, that you may in those situations get one of these vaccines. I look at the I'm going to go into the analysis a little bit here with this, but yeah, I look at like the booster that's not the, I mean, it's nice. And if you're so inclined, I think that's reasonable if you fit in those categories to go ahead and get one of those. But still, the biggest emphasis is just getting that first vaccine, getting vaccinated for the first time, because getting vaccinated for the first time and get up to speed, either whether you need 2 vaccines or whether you do the J&J with just 1 vaccine, just doing that makes a big difference in terms of reducing your risk for being hospitalized. And it helps the hospital. And 6 months, Patricia, between last dose and booster. Yeah, and so where was I at with that? I lost my train of thought. Sorry. So anyhow, if you qualify for a booster, I think it'd be reasonable to do, and I encourage it. If you haven't had a vaccine in the first place, that would be a good thing to do as well. So yeah, that CDC recommendation was out. There were came out about the flu vaccine and whether you can get the flu vaccine. I think there was a question last week about that even. And yeah, you can get a flu vaccine at the same time as the COVID vaccine. You can also get it sometime later after you get the COVID vaccine. They don't have to be sequenced in terms of when you get them. You can get the COVID vaccine a day and you can get a flu vaccine in a week. So you can mix and match as far as that goes. So I want to make sure we made that. And there's a few exceptions to that. If you're a child that doesn't have a spleen, if you have a complement deficiency, if you have basically some like a complement deficiency or HIV or something like that, there are a few things, but by and large, you can get both together or separately without any time lags to worry about. Okay, let me take a glass. Let me sip of water here. I'm having a rough day. Okay. Other piece of news. I read where some folks are using their nebulizers and putting hydrogen peroxide in them in hopes in doing that will, if they have COVID, to try to either prevent it or cure it. Please don't do that. It's not safe to do that. So I just want to make sure I put that out there. Saw another piece of news information, rather sobering, that for men, since 2019, life expectancy is down 2.2 years in our country. Just to give you some perspective on that, if you Google how much life expectancy would be reduced if we cured cancer, it's about 3.2 years. So just, it's a significant thing. And the reason that life expectancy is so significant is that, yes, you've had some cancer tends to be, not always, but it tends to be, as you get older, you're more likely to get cancer. COVID initially was more of older, we're getting sick and dying of COVID, but now as more folks who are younger are getting COVID and getting sick and dying, then that begins to pull down that life expectancy. So that's a piece of news. Another piece of news that I ran across was it's something called MedCram. It's MEDCRAM, and it's a website that puts out information about COVID along with other things. But there was and we'll put a link up here as well as on our website and our Facebook page. But I took a look at the vast majority of this video this week, and it does a nice job of answering some of the common questions I have heard for those who still are, have concerns about being vaccinated. So I'd really encourage folks who have an interest in that to take a look. It's a long video. It's it's a long video. It's 2 hours and 25 minutes. So it really goes in depth in a lot of stuff that I found was interesting and helpful. And I think you can kind of pick your questions that you want. You don't have to listen to all of it. But yeah, take a look at that sometime. Instead of binge watching something on Netflix, you can binge watch this and get some more good information. What else did I? Am I okay? I think I'm here. All right. So a little more news, and then we'll skip to some some final thoughts. So you may have seen this, but the CDC is really strongly recommending that pregnant women get vaccinated. When you weigh the risks of being vaccinated for pregnant women versus the benefits for pregnant women, more and more the data is very heavily in favor of getting vaccinated. Both if you're planning on getting pregnant or think you might get pregnant, and if you are pregnant. Yeah, there have been so far 161 total deaths of pregnant women. So that's just so sad. So, and I'm certain of this too, in terms of the vaccine side of this. People that get vaccinated have side effects. You for sure get, oftentimes 75% of the time you have some pain at the site. You'll get flu-like symptoms, but the vast majority of folks do really well. Over 1 billion people have been vaccinated in the world, and just the risk of that is really, really small of having a really serious side effect or dying from a vaccine versus getting COVID, particularly for pregnant women. So I think it's the number I saw was 31% of pregnant women have been vaccinated so far, which is obviously lower than our overall average in society. I get how folks would be afraid. It's a new thing, but more and more the data is pretty clear on that. So really encourage folks to take advantage of getting vaccinated if you're pregnant. And what else did I want to just make sure I touched on? Yeah. So they've begun doing some preliminary data on people that have gotten the boosters. So far, it was 12,591 that have had the boosters, and it seems so far, at least, that the side effects that people are having who have the boosters is about the same percentage as folks who have had the first 2 shots. So about 80% of the folks have a local reaction of pain at the site of the injection, and about 75% of the patients have some type of fatigue, fever, body ache, something like that for a couple of days. So pretty similar to people that have had the other booster shots. And I think I'll stop there. So just some thoughts in terms of recommendations, opinions on my part would be, it's still not too late to get vaccinated. I think it's pretty likely that you're going to have some lingering on of this COVID still for some period of time, and having that vaccination, particularly given the fact that we know more and more that the vaccine is safe and effective and does a good job. And if you don't get COVID, why get it? In the sense that even if you don't get hospitalized or die, if you've talked to folks who have had it, it's no fun, and there can be some long-term issues from it. So anyhow, encourage folks to get vaccinated. Hang in there. Keep doing the masks when you're inside. And yeah, as much as you can. I say this every week. Things that get you stirred up, that get you anxious or irritable, keep those things to a minimum, whatever those happen to be. And I know I'm on Facebook, and so if that is something that tends to make you get anxious about all this, then watch me, but otherwise minimize your Facebook time, if that's something that's going to stir you up. And if there are things, just the things that you like to do that you can do, that make you smile, and the things that you can be thankful for, make life about those things as much as you can. Encourage you to do that. And I want to make sure if there were I don't think I've seen any questions, but I want to give a moment here if there are any questions that folks who are watching today would want to ask. Be glad to try my best to answer those. Oh, thanks, Marianne. Yeah, I appreciate that. I sure hope the hospital cases go down too. Our staff, by the way, do a fabulous job of taking care all the time they do. But with this COVID thing, and this has been going on now, so I guess I'm going to keep rambling just a little bit. This has been going on for a year and a half now. And I know it's a big deal in the community. But for those folks who work here in the hospital and have to think about how to safely take care of our COVID patients along with the rest of our patients, I couldn't thank them more or be more appreciative of the work that they do. And this is just an opportunity just to say thank you to all of our staff and all the work that they're doing to take care of folks when they end up having to be here at our hospital or at our clinics or anywhere else. And one other thing, and I thank you for that comment, Marianne. And one other thing, just another comment, as I said last week, if you have issues, if you need to have your colonoscopy, you need to have your mammogram, you're having some symptoms that are concerning to you, please don't delay those things. Please seek out medical care for those things. Keep on track with those things. It's important to keep doing that stuff. We're doing as I walk around, you're fine to come here and have those things done. Okay, so please include that in what you do. Just keep doing your medical stuff that you need to do. Okay, well, hey, thanks everyone for listening. Thanks everyone for your comments. I'll be back next week. We'll talk some more, and I'll give you all the news that I have. Until then, have a great week. Stay safe. Bye.